Welcome to We Are Women, Unapologetically, the podcast that talks about careers, life transitions, confidence, and everything in between. Because shift happens, but you don't have to do it alone.
Hello, and welcome to We Are Women Unapologetically. My name is Jessica Cumming, and today I am accompanied by Dana Sherwin. Dana is a consultant and speaker focused on healthcare management and patient-physician communication. In prior executive and consulting roles, Dana worked in hospitals, managed care plans, and 3 public accounting consulting firms. She holds a master's degree of health services administration from the University of Michigan School of Public Health and a bachelor's degree from Cornell University. Dana is also a volunteer with the Blood and Marrow Transplant Clinic Trials Network. She is a member of the editorial review board of the Journal of Patient Experience and a peer reviewer of the Journal of Healthcare Management. She is also a 6.5-year survivor of a stem cell transplant for blood cancer disorder. Dana, welcome to the show, and thank you so much for being here today.
Thank you, Jessica. So happy to be here and have this discussion with you.
Of course. So looking at your background, you have had quite an extensive background in the healthcare industry. I kind of want to take this back even further and just say, how did you decide that healthcare was something that you wanted to get involved in?
I was fortunate to have 2 wonderful parents. I grew up in the suburbs outside of New York City, and I had this sort of very conventional but very idyllic kind of childhood. My mother was a stay-at-home mother, and my father was a rising executive in a health insurance company. And when I was in my mid-teens, he thought he should share his wisdom about careers in the healthcare field, so he brought me home 3 brochures. One brochure was to be a dietitian, one brochure was to be a human resources administrator, and one brochure was to be a hospital administrator. And I thought, oh, this sounds really good. I think I want to be a hospital administrator. And I was all of 16 years old. What did I really know? This sort of like compounding thing was that where we lived was behind a jail and a hospital. So it was either I'm going to have a career in hospitals or I'm going to have a career in prison administration. However, I thought that the healthcare field and being a manager in the healthcare field seemed to really suit me. I was the oldest of 3 children. I liked to take charge. I participated in a lot of school activities in high school. And I was just wanted to organize people and things and ideas and make things happen and do things efficiently. And it was like in my blood. Little did I know that eventually the health condition I had was a blood cancer disorder. But being in the healthcare field, seeing how much my father loved going to work every day, he was just so enthusiastic and he had such a passion for his work. And he just really fell into the healthcare field. I thought, I think this is going to be a good career for me. When I was applying to colleges, and back then there was no internet, I applied to colleges and they all responded and said, we're graduate schools, we're colleges. You have to go to college first before you go to graduate school. So I figured I'm going to try to go to the best college that I could go to and then go right to graduate school. So I ended up doing that. My father was a very big influence in my life from a career perspective, but my mother was the one who recognized that I had academic talents and interests and this desire to do more in the world. And so she really didn't make me do anything in the household. She, go do your thing. I'll take care of everything. I want you to have a career, because essentially she was like not happy with her life as just a stay-at-home mom. And she had 3 children within 5 years and did everything for the family and took care of her parents and my father's parents. And she was a real caretaker, great heart, great work ethic. And so I give them both equal credit in terms of allowing me to find my way in the world and find my own path and realize my own talents and my own interests.
You said that there was an internet back then. So my assumption is also that when it came to being a woman, going to undergrad school, going to graduate school, and going into the healthcare, were there a lot of women influences outside of your family that you saw doing that?
Not really. Because of the position my father was in, he knew a few women who were hospital administrators. I think there were three. In all of the New York metropolitan area at that time, we're talking in the 70s and the 80s, there were three. I had the opportunity to be introduced to all three of them. And they shared with me how hard it was for women in the field and the fact that there was only three. At that time, too, there were more doctors who were chief executive officers at hospitals, but there were absolutely more men than women in that field. I got this glimpse, but what was really shocking to me was the transition from college. By the time I went to college in the 70s, there was probably an equal number of women and men going to college. In college, I never felt the pressure. Women have to be different or work harder or do anything. But when I got to graduate school, that's when I realized the pressures of cultural structures in healthcare, because by the time I learned more about the intricacies and complexities of the healthcare industry across the board, that the women would be more in directors of human resources positions or directors of nursing or directors of physical therapy, some of them more directors in lower levels in the finance departments, but there were still not a lot of women administrators. And when I went to graduate school, it was a 2-year program, Master's in Health Services Administration. 20 students admitted each year, so there was 2 classes there at the same time. And I heard professors talking about, we really need to look at our investment in accepting women into the graduate program. I overheard this conversation because we want to make sure that the women that we accept are the women that are going to stay in the field and not women who are going to have a career for a short period of time until they have children and then not want to be in the field. Being a healthcare administrator is an extremely demanding job. It's not a 9-to-5 job. It's not a Monday through Friday job. It's 24/7 to make sure whatever healthcare operation is operating appropriately.
I know you mentioned that they only allow 20 people in a year, but was that program split equally at the time between men and women?
Maybe it was 60-40, something like that. 60% men, 40% women.
So it's fairly even split. When that professor made the comment about, we want women that are going to be in here to do this, we don't want them to be in this career for a short amount of time, did that influence you at all in what you did with your career and having a family of your own?
My reaction was, I'm going to show them. That was my reaction. I want to have a career, even if I have a family. I know my career was very important to me. And my reaction, very subconscious and conscious, was, I'm going to show them. I want to make a difference. There were a lot of moments where at my graduation from my master's program, and I graduated and I didn't have a job. I went back to New York, and when I was asking one of my professors, I've been applying all over, where do you think my best chances? And his response to me is, go where you think you're going to find a husband. And I went back to New York, not for that reason. I'm so glad I went back to New York, more for my family, because my parents were still alive, and I got so close to my parents as I got older, and my parents got to be closer to my own children.
You were told to go somewhere where you could find a husband. I'm originally from the North, but I went to college in the South. And that was never my mentality going to college. I never thought I'm here to find a husband. But to this day, there are still a lot of young women that is why they go to college, to specifically find a husband, get married, and have babies.
Unfortunately, not a lot has changed. I learned a lot of great things in graduate school, and I did have a lot of great role models. As I looked to do different things and wanted to move up the ladder, I got an opportunity to work at a hospital association. It's a regional hospital association representing probably 250 hospitals in the greater New York metropolitan area. I worked there for 19 years, and I had an amazing career learning experience. The people I worked for recognized that I would come up with new ideas and they'd say, go do it, help solve this problem, and I would do it. So I had a robust career doing that. And I did see over that time, still things weren't really changing much for women. And then I ended up moving to accounting, the big four accounting consulting firms, and I worked at three of them, consulting teams and partners to bring services and resources to healthcare clients, which were hospitals or physician practices or managed care kind of companies. I think that it's always been something that's in my mind for consideration as I navigated my career over the years. I felt because I had a great role model in my father, and we used to have discussions about how to conduct yourself in business and, how to conform but yet have freedom. From a very early age, I wanted to do what I wanted to do, but I was very conscious of conforming within the system so that I could do the things that I wanted to do. And that's always been very important to me too. But they shared that, as a healthcare executive, you are like a role model. So many people are watching you and watching what you're doing. They suggested that you don't live in the community where you work. Just so when you go to a grocery store, that people who work for you aren't seeing you sort of in the wild, because you really have to be that role model. You have to set that standard, and you're the boss. So it's better for you to have like a private life outside of that work life, and also to live in moderation. Those were important factors. And I, found them to be so important throughout my career.
I do like that because of the fact that in certain ways you have to be able to fit into the mold, but that doesn't mean that the mold doesn't change a little bit. I think that that's very important because we oftentimes think that once you conform to certain things, it means you conform to everything. And not getting political at all, but we see that a lot in today's world, that we do see that people are conforming and we're getting away from that gray area. And it's almost unfortunate.
There are opportunities to look at things differently and create new ways of thinking, new ways of doing things, new ways of interacting, new ways of collaborating, partnering, all of those things. When you have that kind of broader view, everybody had different talents. If you have the talent to have more of like top-down thinking and really are so curious, you want to know how all the pieces fit together all the time. And I think that's really where I come from. Like, how do the pieces fit together? What could we do better? But you have to understand so much about the nature of people and nature of humanity, then the nature of the things that you can't change, to be able to figure out how do we get around those things to make things better for people. And for me, my path was this healthcare path, but it was like, how could we get people more access to care? How could we make it easier for people to get care? How do we make it easier for people to participate in their own care, to not be afraid of taking care of their own health, not being afraid of seeing doctors?
As we're moving, because we're talking about changing and all of these different molds breaking, I'm curious to know, what are your thoughts on AI moving into the healthcare space?
AI is in my vision on a daily basis because one of my sons is very, very focused on the potential of AI and what's happening now and what the possibilities are. Now, for healthcare, I watch healthcare specifically through many of the experts now working on it, or going to webinars or reading people's newsletters for healthcare in particular. There's so much potential that's happening. And I don't know whether we're on the brink of it all happening or it's another 5 years away. But let me give you an example. This is a personal example. I have a tendency to have basal cell carcinoma. So it's the lowest form of a skin cancer, right? When you can catch it on time, it's slow growing, but it's there. If after a few years you need to have it removed or whatever, you have to be monitored, you have it. Okay. The only way right now that they have to identify it is really from visual inspection. So I saw some research where there was this tool that was being developed that you put the tool over the person's skin and it's able to go several layers deep into the skin to identify there's a basal cell carcinoma. And when I asked my doctor about it, he said, yeah, it's under research right now. Who knows, maybe another 5 to 10 years. But right now I'm living my life and I know I have this issue and I really want it to be here sooner than later. So that's like an example, this like on the edge, this technology, that it's about to break through. And I think it's really exciting. So it's like medical technology and AI together. There's a lot of stuff like that that's coming out. What people are really talking about now is, for me, like a very base level. What they're talking about is AI related to transcribing discussions between doctors and patients and putting into the medical record. Well, I don't know about you, but I'm not that excited about it. Yeah, this should have been happening like 10 years ago, and it didn't. So this is like what is on the tip of everybody's tongue, but we're doing this. We're going to make it easier for doctors. Well, I talk to my doctors about this because this is what I do now. I try to figure out what's going on with doctor communication with patients and how patients can understand what doctors are doing. They haven't yet really figured out a great software product to help them do that. And when they do, they still have to review the notes and make sure they're right and put them in the right place. And they all use the same software system for electronic medical records. And there are a lot of problems with that too. I mean, it's better than nothing. It's very incremental right now when it comes time to record keeping, to communication, to helping people follow up on things for their care, to giving people more information. This is definitely on top of my list. How can AI make healthcare better for people? The thing that I guess that I think is going to come sooner than later and is available is that there used to be just Google. You Google your diagnosis. You Google, like, okay, questions to ask your doctor. You could Google, help me understand this better. But really with AI, you get a whole story. You can put in, this is my condition, these are my symptoms, this is my diagnosis. You put that into any of the AI platforms, and it will give you back an entire, really, book. Now, on one hand, it could be very overwhelming to people to have this. So I can't understand what it's saying. I can't read my own reports. But there is this potential of AI being able to sort of help prepare people to have these conversations with doctors. So I think AI has great potential, but the bottom line is, will the people have the focus, discipline, and putting down fear a little bit to try to read it and understand it? I know 25 years ago, my head was not there because I had a career, I had kids, I had a house, I had a very busy life. The last thing I wanted to do was identify that I had some underlying condition. And I did. I had an underlying condition, and I didn't do anything about it until I had to do something about it.
That's a great segue because I do want to segue into your life and what you have gone through in your own personal journey. Tell me just a little bit in general about your diagnosis, and were there things that you saw that maybe could have let you know sooner, but you just really were not ready to look at those signs?
My diagnosis was a blood cancer disorder. First diagnosis was I had too much blood in my system. And so this was diagnosed because I ended up having a blood clot in the portal vein of my liver, which I was having pain. And then a doctor sent me for a sonogram, and then they sent me for a CAT scan because they were very concerned. And then I had to go straight to the hospital to dissolve that blood clot, or else if I didn't take care of it, I could have died from that. I had a blood clot because I had a genetic condition, not inherited, so not from birth, but after birth, a genetic change to my DNA, which caused my bone marrow to malfunction and produce too many red blood cells, so too much blood in my body. So because when you're a woman and you're menstruating, the blood goes out naturally every month. And so one symptom, which I don't talk about too often because I usually don't go back that far, when I was a teenager, I had extreme pain when I had my menstrual cycle. And a lot of women do and did. And now that you can take Advil, before Advil became over the counter, it was only a prescription drug. So during my teenage years, it was a prescription drug. And how would you know to go to a doctor because you have menstrual pain? And so I didn't know what it was. I thought it was just like some women just have bad periods than other people. And this lasted till my mid-20s. Then Advil came out over the counter, and I got to relieve my pain. Starting in my mid-30s to early 40s, I started having a lot of itching on my skin after a shower, and I just said, "Oh, I must be using a different soap or something." I was just very itchy. The symptom is called pruritus, so I had a lot of itching. I didn't think to tell anybody about it or do anything. I self-treated. Every little symptom I had, I self-treated. So that was one thing I did wrong. The second thing I did wrong was that my primary care doctor was my OBGYN because I had my children in my 30s. And so from your 20s, you're seeing a gynecologist regularly, not too many women in their 20s or even men, which is I advocate for. People should have a primary care physician or an internal medicine doctor who's seeing them at least once a year. And I was seeing an OBGYN for my whole adult 30s up to my early 40s until I had the blood clot in my liver. And then I was tested and I had this disease, which was called polycythemia vera. And that is a myeloproliferative neoplasm, a blood cancer disorder. People with PV, polycythemia vera, can live pretty much normal lives. They have to routinely be monitored by a hematologist, and they have to take blood out of your body. They monitor you. And there's some drugs now that can help control, and so people could have better quality lives. There are symptoms that might come with it. But for many years, I was able to live a fairly normal life. Every few months, I went to the hematologist, I got checked. And then I think after 7 years of that first diagnosis, my bone marrow started drying up. And so it's called a spend down phase. So first you have too much blood in your system, and then you have too little blood in your system. It all comes from the same genetic deformity. And then when you have too little blood in your system, there is no cure but for a stem cell transplant. So I put off having a stem cell transplant for many years. My sons were still in high school, applying to colleges. I still felt okay, a little bit tired sometimes, getting headaches, but everything on the internet now was saying that there's only a 30% survival rate from a stem cell transplant.
What was the pivotal moment that you did decide, you know what, I do want to go ahead and look at having the stem cell transplant?
So that generally it was a very difficult time for me. My sister was very ill and living with me at the time, and my health had crashed. She started living with me about a year before my health crashed. I was taking her to doctor's appointments and taking care of her, but my health was getting worse and worse. And she was on home hospice care, and I had started to do the planning with my doctors. It's probably a 3 to 4 month process to prepare for stem cell transplant. Number one, if your family members, mainly siblings, aren't a match for you, then you need to go to a national marrow donor base to check for matches. And I was fortunate that the doctors and that the national matching database did find what they considered to be a perfect match for me. And then I had to do a lot of preparatory tests, and I wasn't feeling good at all. I was in a lot of pain and really sad and really scared. And I had to do a lot of financial planning because of my children and my home and everything. I mean, I'd done a lot before, but there were things, always tying up loose ends. And I was also preparing to go into the hospital for 5 weeks because that's basically how long it takes. But the big moment came to me. I knew I had to do what I had to do. There was no other chance. I wanted to be alive and to do whatever I could to stay alive. And I thought, while I was doing all this planning, it was like I just came to this conclusion that if I don't get it done before I get into the hospital, because all I was thinking was, I got to do all this stuff because what if I don't come out? And then just one day, my whole mindset switched. And it wasn't, if I don't get it done before I go, I will do it after I come back. And what a switch. I mean, whatever was in me, it wasn't like I was consciously thinking about how can I handle this better. It was just this switch that said, I want to live for me. Yes, I want to live for my sons and my husband, but I want to live for me. And that seemed to be, I'll do it when I come back. That was such a pivotal moment for me. And then I went in, I was very fortunate. I had so much great family support, and I really believed and trusted my doctors. I was told by my doctors, You can't act like you're in charge. You have to let the process unfold. So from the moment I was admitted and needed a port installed, and I knew I was going to be isolated in a room, and I knew what this process was going to be. They did a great orientation program, so I knew what life was going to be like for the 5 weeks that I was there. I just have to relax into the process and do what I can do to take care of myself so that I could leave and go home and have the most normal life possible. And I was very fortunate. Everything went very well. I mean, there's a lot of ups and downs in the 5 weeks, but I was able to go home. And yeah, I had a lot of doctor's appointments, but I just was so resolute on, this is for me. This is for me so I could be here to be for the ones that I love, but I'm not living for anybody else but me. I deserve to be here. I still have more to do. I still have more love to give everybody. And that was my raison d'etre for the strength that I ended up finding that I didn't have at the beginning of the process. My sister at 58 years old died of a brain cancer, and taking care of her and then having my own struggles and then doing this. But again, I was so fortunate that I had the support around me and great medical care. And it wasn't easy. I had a rocky recovery for about 3 or 4 years. And then one day I sort of woke up and said, I know I can't have a job like I've had in the past, but I want to do something. And so the something was inspired by my hematologist oncologist. She actually introduced me to one of her fellows, and she said, meet Dana, she's one of our best patients. And I thought, oh, that means my health is doing well and making a lot of progress. She goes, no, I don't mean that. I mean, you come to every appointment so prepared. You ask good questions. You keep us on our toes. You really take care of yourself so well. I said, doesn't everybody do that? And she said, no, not everybody does that. And it just was this light bulb that went off that, well, maybe this is something that I sort of know how to do, but I want to figure out how to do it better. So I spent a year researching and writing and thinking about the topic. And then it really turned into me developing resources to help other people. And that's what I do now. I speak and write on the issue of patient engagement and patient-physician communication. I suffered a PTSD from suddenly being ripped from my long-term career in healthcare and having to face this horrible disease with no guarantees for survival. And I came out of the other end. It's not something I wish on anybody, but I did find new strengths in myself and a renewed purpose for me to continue to be involved in working with people to have better outcomes for people's health. And so that really has been my journey. Since my transplant in 2019, it's been my journey, but more in a much more focused way in the last couple of years.
This is a really fascinating story, Dana. First of all, I want to acknowledge your fight and will to be here, to be able to get things done that you didn't get to get done before. And it almost sounds like that list of things that you needed to get done weren't even known to you, because the work that you're doing now was something that has come out that you probably just didn't know it. So I do want to talk about that a little bit. What are some of the top things that people are not necessarily prepared for when it comes to their doctor's appointments or when it comes to diagnoses that they should be?
Every single individual is different, and symptoms can show up differently from one person to another person. That's why a lot of people end up being misdiagnosed, or they're not seeing a doctor who's had experience with this particular specialty. Coming to grips with, I'm able to learn, no matter what your level of literacy, your health literacy or understanding is, to the best of your ability, to learn more about you, your body, what's available for you to monitor your own health, to take care of your own health, to communicate better with doctors. All of these things are just so important. And I just think this is a missing piece in the whole healthcare pie, like you so articulately said. I figured out things that I didn't even know that I was sort of meant to talk about and do. It crystallized because this one doctor turned to me and said, I think you're onto something. You're onto something, because people just seem so lost about taking care of your own health. And I think there are ways to do it. And I would advocate for, look, from an early age, my own children heard me, how I interacted, and I did better helping them with their healthcare than I did for myself. But when you're able to figure out how to really take care of yourself and knowing what's important, even though you don't want to do it. I mean, there's so many things in life and all sort of mindset studies and mindset actions that people can take today. It's the same thing. What is important to you? What are your priorities? And just learning a little bit more every day, or for every doctor's appointment, seeing a doctor once a year, seeing a dermatologist once a year, an allergist if you have an allergy, if you think you might have hormonal issues. And again, the using of AI to figure out, like, I am a 42-year-old woman. What are the kinds of health concerns that I should be thinking about? What kinds of doctors should I be seeing routinely? And then just really being able to navigate very complex healthcare systems. And in some systems, you need to get in there before you're sick, meaning you need to be known to the system before you're sick. So when you get sick, they know who you are. They have all your information. They have all your test results. And there are doctors who know you and care about you. And that gives everyone a leg up as well.
I think that's really important because a lot of times people don't want to go to the doctor until they're sick. And then it takes longer to diagnose. It takes longer to figure out more about your medical history. It takes longer to do the testing because all of a sudden you come in and they have no idea what's happening. But if you're routinely seeing a doctor, they're able to track some of these things. They're able to look back. They're able to see changes with routine blood work, routine exams. So I think that that's great advice.
This is what I talk and write about on a daily basis because it's so important. So many people are afraid there's something wrong with them or they don't like seeing doctors, but taking care of one's health is really each person's responsibility. It's no longer, I will see the doctor will fix me. I'll do whatever the doctor says, but it's not really having the agency that you need. And the agency that you need really comes from learning new skills, acquiring new knowledge, developing new habits, developing a confidence, and I think mainly understanding that we're not educated with the knowledge of how to be engaged in our healthcare, how to work in partnership with doctors and other providers. They don't teach you in high school, in college. Your insurer doesn't teach you, your employer doesn't teach you, and certainly doctors don't teach you this because they have 15 to 20 minutes to have an appointment with you, to have a regular clinical appointment. There's no time and there's no place in our process of being alive that somebody's going to teach you to be an engaged patient. But what I have found, it's just so critical, longevity and wanting to do things to improve your life and having a longer life. But in order to do that, it's not just taking more vitamins or exercising or eating the right foods. There's so much medical knowledge and technology today to give you a better foundation for understanding your own body, understanding your own mind, understanding how you are.
In order for people to connect with you, to learn more about what you do or hear you speak or see some of your writings, how can they find you and get a hold of you?
I think the best way is, since I've been writing for the past 2 years on LinkedIn, I call it my blog post, and I write on subjects. It's not about congratulations or how are you. My LinkedIn posts are about issues in healthcare communication that are important for people to know, or new things that have come up for me that I research and I write about. So you will get a 2 years worth of my best thinking about how to communicate better with doctors and things that you should be thinking more about and learning more about. I do have a website, thethinkingpatient.com, and that's sort of for my consulting direct to businesses and organizations. People can reach me through LinkedIn or through my website.
I know that you mentioned with organizations. Do you work one-on-one with people as well, or specifically businesses and organizations?
Just businesses, organizations, specific community groups like cancer wellness kinds of programs, workshops, and then employer efforts to help their employees use their health benefits more effectively by being able to navigate the system and engage in their care.
I'm very curious to know. When you look at all of your accomplishments prior to your diagnosis versus the work that you're doing now, where do you feel as though it did, or does it now light you up more?
I've been excited about my entire career, and I guess I just wasn't ready to end it. Just finding new areas that I can bring innovation and ease to the healthcare process and sort of just help people through helping organizations and helping community groups. Now it's this opportunity for me to spread my message in different ways and be able to still stay connected, even though I still have a lot to do to take care of my own health and I don't have the same level of energy that I used to have before my diagnosis. But I am happy to be talking about this issue. I always learn something new, and that's what excites me. Like you today, meeting you today, the different kinds of questions that you ask me, that kind of stuff turns me on, which just sort of reinforces that I am on the right track in my life, and I hope it lasts a very long time.
Well, I hope it lasts a very long time as well. I look at this conversation and you started in a field where it was heavily male dominated. I don't think that there was that many women that were looking at being healthcare administrators at that point in time. You did what it took. You proved people wrong to create the life that you wanted when it came time to balancing both a career and family. You then were hit with a roadblock, and honestly, more than one, because you mentioned that you were taking care of your sister as well. You didn't want to do the transplant at first, all of these different things. So it was met with some resistance. And then you found a way to still do something that you loved to help people. And I've talked about this on other podcasts, and I'm sure that you've heard this before, but it really sounds like what you are doing now is your zone of genius. It's something that you know a lot about. It's something that people need. And it is something that lights you up. So I commend you on that because it's not always easy to do that. Sometimes people see this was taken from me or I can no longer do this. And they end there. They don't think about how can I repurpose my skills? How can I still do something that I'm passionate about or love and what people need, right? How can I still make an impact in the world? Thank you so much. This was a very educational conversation. It was very eye-opening. One of the last messages here is go to the doctor, get things looked at, learn your body, listen to your body. But is there anything else that you would add to that as we look at wrapping up today?
Be curious, take care of yourself.
I love that. Be curious and take care of yourself. Love it. For any of the listeners and watchers out there, if you would like to connect with Dana, we will make sure to have her information in the show notes. And if this resonated with you, please like, subscribe, share it with a friend. And until next week, stay fierce, stay bold, but most importantly, stay unapologetically you.